I'm Lori Hutchison. I'm the Executive Director of the Lobular Breast Cancer Alliance. And actually, before we get started, I have to announce our really exciting news that we've just issued the first ever Young Investigator grant solicitation, ILC focused research that we were able to fund and are going to be issuing in collaboration with Conquer Cancer, the ASCO Foundation. It's a $50,000 grant for 1 year for an early investigator focusing on ILC research. And applications, the solicitation went out April 1st, and applications are due on the 21st. And we are so excited about this, and we're going to be issuing another one at the end of the month with AACR, similarly, another early investigator grant, but this is just amazing news for us, and we are excited to be stimulating more ILC research. So that's our big news. I want to welcome everybody to our second presentation in LBCA's Advocacy Chat series, and today's focus a conversation about advocacy and social media. Before we begin, I just want to share a couple things about today's session. First, the presentation portion is going to be recorded and all of you will be muted. And if you have questions throughout the presentation, we ask that you please write them in the chat. We'll be monitoring that, and we'll get to them in the second portion of the conversation when we open it up for questions. When we get to the Q&A period, we will not be recording. The way we're going to handle it is that we'll present first any questions received in the chat to the panelists. That's being handled by our moderator. And as questions occur to you, as the Q&A opens, you can just indicate that you'd like to ask a question in the chat, and we'll call on you and unmute you. And last, I just want to remind everyone that this is not a conversation about people's personal issues, so please avoid questions about personal issues or specific medical questions, as we will not be able to address them during this conversation. And now I'd like to introduce our two panelists today. First, I'd like to introduce LBCA's Communications Director, Colleen Fitzwater. Colleen's an accomplished executive with more than 25 years of experience in the nonprofit and broadcast industries. She's administered a spectrum of communication and marketing initiatives in the cancer field, including integrated communication and marketing planning and implementation for both mission and income generating programs. Colleen's work has received recognition not only from communication peers such as PRSA and IABC, but also medical associations such as the ACG. She's a graduate of Temple University, and Colleen is currently almost finished her master's program in strategic communications from LaSalle University. And it's also almost been a year since Colleen has been with LBCA. Our other presenter is patient advocate and LBCA founding member presenter, Diane Mapes. Diane's a journalist and patient advocate working at Fred Hutchinson Cancer Research Center. She writes about research and the patient experience in the realm of prevention and risk reduction, health disparities, health economics, early detection screening, and survivorship. And Diane blogs and tweets as @double_whammied. And we're really excited that Diane is willing to share her expertise with us as well in this conversation today. You may have seen we've featured a lot of her blogs and stories on our website, and she's been a great advocate and user of social media on behalf of all of us with ILC and interested in advocacy. So I'm going to turn it over now to Colleen.
Thank you, Lori. Really happy to be here, excited to share this information with you. We know from the survey that we sent out to you with registration that some of you are brand new. potential social media advocates for us. And some of you, I see faces and I know that you are pros at this already. And we hope that everyone will take something new away from this today. So I wanted to take you through our agenda, our learning objectives for the day. First, I'm going to share with you LBCA's online presence. When you turn on your computer and the internet, what are you going to see as far as LBCA goes right now? And included in that, the audiences for the different social media platforms, or at least who we believe our audiences are for those. Next, why should you use social media to advocate for us for ILC? Then we're going to take you through how you can get started if you've never done it before, or maybe you think you've never done it before, how you can get started. And we're also going to share some LBCA social media resources with you as well. And then finally, we're going to deep dive a little bit into Twitter, and especially around research advocacy. It's a pretty important platform, including questions like, well, who should I follow if I'm just starting out, and who are some of the influencers that are out there right now? So that's our plan for the next hour or so. So first, let's take a look at the online presence. And we were so excited that on March 25th, just a few weeks ago, we were able to relaunch lobularbreastcancer.org. If you haven't had a chance to go and visit the new site, please go and visit the new site. We do, for our advocates, have 2 pages now. There's an advocacy through education page, and then there's also a research advocacy toolkit as well. So we've broken up the education information and the research advocacy into 2 different pages for you. Next, I wanted to talk about Facebook, and thanks to all of you who are following us and liking us on Facebook. We did just hit 2,000 followers on Facebook the other day. Very excited about that as well. And I wanted to talk about the audience for Facebook a little bit. So what we've learned is the majority of our audience are really people who've been affected by ILC. It could be those who have had ILC, those who are caregivers to those with ILC, family, friends, loved ones. So that's really who is following us right now on Facebook. And, you know, if you think about you as a potential or as a social media advocate, you have your own audience on Facebook. I know most of your settings are most likely private on Facebook, but you have your audience. They're normally your family members, your friends, your coworkers. If you like them, you'll ask them to be a Facebook friend of yours. And so just remember that even though, you know, we are an organization that promotes advocacy, you can be your own great advocate on your own personal Facebook and other social media sites. You have the opportunity here to be an advocate by educating, you know, about lobular breast cancer to those personal audiences that you have, what it is, signs and symptoms of it, and even how more research is needed as well. You can spread information that we post, you can share that information, and you can always ask people to donate as well, so we can do more great things like have more research grants that are going into effect very quickly. So next is Twitter, and our handle on Twitter is @LobularBCA. Twitter right now for LBCA has about 1,100 followers. We're gaining more every day. And this audience is a little bit different from our Facebook audiences. And something else to remember, that Twitter pretty much for the most part is pretty public too. It's not as private as Facebook is. So we do have those same folks that are affected by ILC, but then when you also bring into our Twitter audience is more clinicians, more researchers, research institutes using this platform. As a matter of fact, I noticed this morning after the grant announcement, we actually have a brand new clinician from Brazil who just started following us. So again, we're going to spend a little bit more time with Twitter in a little while because of its importance to our social advocacy efforts. Then just to touch on a couple of others, LinkedIn, I started maybe late last fall, early winter. We do have a LinkedIn account now. Please feel free to follow us there as well. So again, a new area for us on social media. And the hope with LinkedIn is to build deeper professional relationships using it. So, I have a huge contact list. I'm sure a lot of you also say, yes, I'd like to connect with different people. And what great things can happen there is, for instance, we're looking for board members for Lobular Breast Cancer Alliance. And it just so happened that, we shared that information on LinkedIn, and we got a new board member out of it. So you just never know how that information is going to go out there and be received by somebody. Then also YouTube. You'll see right now our channel, we don't have a name for our channel yet. So please go and subscribe. We need 100 people to subscribe to us to get an official Lobular Breast Cancer Alliance channel on YouTube. And video is very important just because of shorter attention spans that people have these days. And also, it's something for you to think about as a social media advocate, is seeing your faces, all of your faces right now, hearing your voices, for you to be able to tell your story on video if you want to do that. It just brings so much more to the conversation as well about ILC. And then finally, some of you I know are on Instagram. I'm personally on Instagram, but we're just not there yet as an organization. And that should not stop you from using the tools on Instagram, again, including video, to be able to advocate for ILC on social media. So why use social media to advocate? And I thought to myself, that's a really good question. And I did actually find some bullet points. There's been some research that's done on why you use social media as an advocate. So you can see the different bullets here: to spread information and educate others about our cause. You reinforce and grow relationships, promote dialogue. And, let's face it, social media is all about having a conversation with someone. It's just different tools to be able to have a conversation, to begin better collaborations. And then the speed, just think of what the speed is of social media. The difference between a newspaper in the past and how quickly something goes up on social media nowadays. So I just wanted to share that with you. And then I do actually have a question, because Diane has been sitting there patiently and we do want to listen to her. So Diane, when it comes to research advocacy, can you speak to how social media is changing the way that advocates can connect and interact now with researchers and clinicians?
Oh, of course. Thank you, first of all, for asking me to participate in this. And it's really great to talk about a topic that has come a long way. Social media, when I was diagnosed 10 years ago, clinicians and even researchers were very much opposed to using it, very much opposed to having patients use it. I'm sure people are still hearing now, their doctors are saying, stay away from the internet and all of that. At this point, that has changed quite a bit. Just this weekend, yesterday and today, is it's the inaugural meeting of the Collaboration for Outcomes using social media in oncology. So there's a huge collection of clinicians and researchers on Twitter especially, but on other sites as well. And the patients are they're not being discouraged as much to go to these different ways of communicating with different groups, other patients or clinicians or researchers. And researchers are actually using they're advertising for participants in clinical trials on social media now. They're tapping into Twitter streams and Facebook groups with permission to extract that data, which can inform studies. So researchers are finally paying much more attention to how cancer patients receive and disseminate information. And as always, it's very important to make sure that that information that we are consuming and that we are broadcasting is accurate, evidence-based information. So it's really good to work in tandem, I think, with the research community and to help, broadcast, messages that are useful and accurate and not misleading and accessible. And that's another thing with research on social media and using social media. Clinicians and researchers are much more accessible on sites like Twitter, I've found. As somebody who reads scientific papers pretty much for a living, and someone who can, they can be pretty dry and they can be pretty dense. So it's really nice to be able to get the clear, concise communication from clinicians and researchers via social media, because it's much easier to understand and much easier to just the process of putting something really, really complicated into 240 characters really helps simplify it for folks like us who, have to rely on science for our life, but we didn't necessarily grow up with it, or, we're not necessarily doing it for a living.
Great. And we were just talking the other day about the Metastatic Breast Cancer Project and social media advocacy. Can you share more about what that project is and how social media helped that?
Social media sort of made that project. And by that, I mean the patients on social media, patient advocates, helped promote this idea of having the patients inform the research that the Broad Institute, where the Metastatic Breast Cancer Project and all their projects is housed, and Dana-Farber. And what they did is they wanted to do a study where they were able to directly engage with patients and ask them for permission to send them spit kits for DNA, patient records, EHRs, all of this stuff. And then they would be able to go through all this information and look for patterns to see who the patients are that are responding super well to some drug, to see patients who maybe don't respond as well to the drug, to see, what their biological data is, and try to read more into it. So Metastatic Breast Cancer Project was the very first one of these Count Me In projects that the Broad launched. And they first started by talking to patient advocates via social media. What are you looking for? What do you need? Does this speak to you? Does that speak to you? They checked in with patients first, which was super smart because that made us all stakeholders. And then when the projects were launched, everyone who was involved with this Metastatic Breast Cancer Project was really compelled and engaged and delighted to share the information. They were able to recruit an incredible amount of patients for the first project, MBC, something like 4,000 patients in less than 2 years or something, which is, I can tell you for, scientific recruitment for a clinical trial, that is just like beyond the pale. It's like, wow. And now they've gone on to launch several additional projects with that same process. And with the Metastatic Breast Cancer Project, they also were able to cordon off a metastatic lobular section of that, so we can make sure that we know how lobular patients who have metastatic disease are responding to therapy, if there's any patterns there, anything that we could use. And the information is all available for other researchers to borrow the data and to utilize the data for their findings. So it's a very patient-driven, patient-engaged project, only one of many that are happening now.
Yeah, that's incredible. That's a great example. So what I wanted to do, everyone, is you may have been able to take a look at Lee Pate's Introduction to Advocacy chat. If you haven't, it is available through YouTube, and you can also find it through our website as well. And you will remember her discussing how advocacy can be used to educate and to raise the visibility of invasive lobular carcinoma, as well as the need for more ILC research. And so, as Lee pointed out, social media is a really great tool to get those messages out there. And again, how do you do this? I highlighted this part of Lee's PowerPoint slide. You can tell your story. You can share information about lobular. You can start a conversation yourself. If you're not that comfortable starting a conversation yourself, then you can latch on to someone else's conversation. You can comment on other conversation. You can ask questions about it. And again, social media, once again, at its heart, is that conversation. So let's talk about how you get started. Again, there's a lot of newbies on the call, and there's a couple of experts as well, and Diane is one of those experts. So Diane, can you tell us, how did you get started using social media to advocate?
Well, a long time ago, I actually started on Twitter before I started on Facebook. I started on Twitter, I think, in 2007 with my original Twitter feed, Single Shot. I've got a couple. When I was diagnosed in 2011, I started an anonymous feed, which you can do if you don't want to use your name, and I didn't. I wanted it to have some way that I could process my breast cancer diagnosis and process the whole, I hate the word journey, but the whole madcap adventure. So I started on double whammied with my personal situation, talking about, what I was going through, the fear, anxiety, and then side effects and this, that, and the other. And then once you come out of treatment, I think this is a pretty natural arc. You start thinking about, you start reading other people's stories and seeing what other people are going through. And then you start realizing, oh, dear God, there's so much wrong. There's so much that needs to be fixed. So when I first started advocating, I think the first thing I did was try to get out information about dense breasts. And I think that that's a good message that ties in with lobular, because dense breast tissue has a tendency to hide lobular, which already has a tendency to hide because it doesn't image particularly well. So that was sort of the first entree into advocacy, is getting the word out about it's important if you know whether you have dense breast tissue, and it's important to know also that there could be something hiding in there, and that something isn't necessarily lump. That was the other piece that I started with, is that, did you know there's a breast cancer that does not make a lump? Because I did not. And then went from there. Hope that answers your question.
Yeah, it definitely does. And so what would you say? I know you said you started on Twitter, you moved on to Facebook. Do you think that you've seen your social media use change over time in the area of advocacy?
Yeah, definitely. I mainly do advocacy, personal advocacy on Twitter. I'm an admin for a Facebook group, and I'm happy to see some of the moderators like Kristen Lbca are on this call.
And do you want to give it a plug? Do you want to give it a
Yeah.
plug right
now?
now?
It's just the Lobular Breast Cancer ILC group on Facebook. There's a couple different ones. And then there's one for people with metastatic lobular disease. So they're pretty easy to find. You can just search for lobular breast cancer. There's another one called the ILC Sisters that's run by one of my moderators, Sheila Harris, another really great advocate out of Australia. But Twitter is where I do most of my advocacy. And my advocacy has changed a lot, just along with my my learning curve and learning about cancer. And in the early days, I would try to put out helpful information, but I did not have the best knowledge base to be able to discern. And now I can see that there are very important places where you can get good, accurate information, but there's so much out there that it's easy to be overwhelmed, and it's really good to make sure that you're putting out the best information. And so it's not just any study that's published, it's the studies that are published in what they call high impact journals, which are the better journals. So I hope that this is helpful for you, but there's a lot of different ways that you can use different social media channels to get messages out, and you can speak to what matters to you the most. For me, I don't just advocate about lobular, I also try to advocate for my other friends and neighbors and other cancer patients and other groups that might be more marginalized or not heard as much. I think it's really important to raise voices for people who are not heard.
Thank you. And so how do you think, and I'm going to ask Lori this question as well, but how do each of you think people can help the most? So again, let's say I'm a new social media advocate. I really want to get out there, start using my platforms to advocate for ILC. So how do you think people can help the most when it comes to using their personal social media to advocate for lobular, whether they want to educate people, whether they want to get into research advocacy?
Lori, do you want to go first on that?
Sure. So I think it's a very personal decision to whether you want to use your personal social media. I'm thinking about my personal Facebook page because it's sort of like coming out, and some people aren't so comfortable, sort of announcing everything about their diagnosis or their relationship to lobular breast cancer. Other aspects of social media are, a little less personal, like retweeting. And I certainly started pretty soon after my diagnosis with the just fervent desire to get the word out to everybody I knew. First of all, that there were breast cancer subtypes and how little was known about lobular, and that was my issue. And so I immediately did a Facebook fundraiser for my birthday. Well, actually first for my anniversary of my diagnosis and then for my birthday. And I found it a good way to both get the word out about lobular and also to raise some money for Lbca. I also, with my Twitter account, which I don't go to too much, but I feel like that's really the place to boost the new information coming out, to excite the scientists and researchers. And I feel like it's really important for us to keep all the new information coming out circulated there. I was very happy with the LinkedIn results we got in terms of recruiting a board member, in terms of recruiting staff. So I feel like, and I've used my personal pages on Facebook that way as well. So, I think it has to do with your comfort level, but it's felt good for me to inform friends and family too. And now I have, it took me about 2 years. Then I started asking them all to like the Lbca page, and it's really kind of heated up. So that's how I handle it.
Diane, any additional thoughts?
Yeah, and Lori, I applaud you for that, plunging right in with the fundraising on Facebook. That's very smart. And I will readily admit, I do not do as much of that fundraising, help me raise money, just because of personal comfort level. I think I'm much more comfortable sharing information, and that's what I try to do. And I think that that's what can help a lot. Again, you have to be careful that you're sharing good, solid, evidence-based information. It takes a while to kind of figure out, that maybe that journal that's published in, I don't know, some tiny country somewhere with half a scientist, might not be as good as something published in Nature, Cell, New England Journal of Medicine, JAMA. But it's important to make sure you get good information. I think that it is a personal choice if you want to share this stuff on your own, your own feeds, but there is the option on Twitter to have an anonymous feed, which is what I did with Double Whammy. Now, I am not anonymous anymore. With everybody pretty much connects my name with that Twitter account now. But at the time when I started, it was really helpful to have it be anonymous because I was processing so much personal stuff. Now, I don't process a whole lot of personal stuff on that feed, but I am reaching out to researchers directly. You can figure out where they are and look them up. And I have found that it's a really great way to be able to have, access to people that you don't necessarily have access to. So Twitter can be very democratizing. And I love that about that. You could send direct messages to people. Those are like, little private messages, not public messages. You could connect with researchers. You can connect with other patients. You can live tweeting of conferences is one of the ways that I think that patient advocates can truly help the most. And right now, all the conferences are going virtual because of the pandemic, and many of them are free. So they're accessible to patient advocates, which is fabulous. And then you can listen to the presentations and you can tweet out the findings to your audience and to the greater audience by the use of hashtags, which I believe Colleen will be going into shortly.
We will be. So let's first, before we get to Twitter, Let me just quickly let you know that, again, I love the fact that both of you talked about comfort levels. So whatever your comfort level is, if you don't have a lot of comfort at this time and you want to root around a little bit on our website, we do have a place you can go. It's lobularbreastcancer.org/social media. We have some sample social media posts up there. We have a great volunteer, Evelyn Bordeaux, who is helping us to create some more. There are some shareable graphics on that page as well. So if you want to dip your toes into social media advocacy, you can do that. Diane mentioned about accuracy, and these are coming from us, and that this will be accurate information. And just one more thing with accuracy, because Diane keeps on mentioning as well about studies. Also on our website, you can go to the ILC Publications Library. That is on there, that you can find that pretty easily. And what we do with those is we have a list. Julia, another one of our great volunteers, I'm not sure if she's on today or not, but she goes through those with our scientific advisory board members. They're the researchers, and she makes sure that anything that we have on that library is up to date. And sometimes they talk back and forth about whether some studies should be added to that list or not. So there you go for accuracy as well. So let's do this. Let's go into Twitter a little bit. Again, I wanted Diane on this call because she herself is an influencer on Twitter. So Diane, before we get into the nuts and bolts, I think you've talked about this a little bit already, but why do you use Twitter? What are you trying to accomplish when it comes to lobular breast cancer advocacy in Twitter?
I'm just trying to get the word out.
Perfect. Yeah.
That's pretty much it. And, LBCA is new. And this news that Lori just announced today is a fabulous first tweet for any of you who are interested in advocating. I mean, this is a wonderful message to get out, very exciting. And we've got, not just one, but another grant coming too that we're able to give to young researchers. So that's a great important message. The most important message, I think, is you are not alone. There are many people out there with lobular breast cancer, and it's very important for people who are diagnosed with it to know that it's not, your run-of-the-mill average breast cancer, that it's a distinct subtype, and it has a distinct metastatic pattern that is different from ductal. There's some overlap, but it's not exact. So this is important, I think, is to make sure people know the uniqueness of the disease, and that they know it is not studied as rigorously as it should have been by now, because it is this unique subtype. There's a gap of information. So I think that those are important messages that I would try to be getting out.
Awesome. Thank you. So we'll go a little bit more quickly. I know we want to make sure we have some time to answer your questions as well. There is a great guide out there that Twitter puts out called, and included in that is a guide to Twitter lingo. A few of the things that you should know if you are just starting to get involved with Twitter is there's a limit of 280 characters, and they actually raised that in the past few years. To Diane's point, though, it's great because researchers, if they're tweeting, really do have to figure out what it is in a very short amount of lines of characters. If you take a look at the hashtags, a hashtag is simply what you see when you have that hashtag symbol before it, the pound sign. It used to be on the phones all the time, we would call it. It helps you to connect conversations, to find content. You can put in hashtag lobular and see what is coming up. A lot of times it's going to be ourselves, our advocates that are out there talking about the content. They bring people together around a topic like ILC. And again, you just tap a hashtag to see what other tweets are out there. And then, you can help build your own social media presence by using some of these hashtags here. And just so you guys know, I'm learning something new every day. I just learned yesterday from the folks at ASCO from Conquer Cancer that we want to start using with any double words that we do, like breast cancer, was breast cancer in particular. We want to make sure that those are capitalized, breast and cancer, because it makes it more accessible to people with hearing loss. So I just just learned that yesterday myself. And then Diane, can you talk about what of these hashtags do you use the most? And there any other ones that you've used when it comes to lobular, talking about lobular online?
Sure. Very interesting point about the capitalization. I have not heard that either, Colleen. Thanks
I
for
know,
sharing that.
see, hopefully we
Yeah.
can all take away something.
Exactly. Hashtags came into use, I believe, with this organization called Simpler, and they put together what they called the Health Hashtag Project. I think the very first health hashtag was HCSM, which stands for Healthcare Social Media. And all the other, it seems like a lot of the other cancer advocacy organizations have followed suit. So you have BCSM is breast cancer social media. Then there's LCSM, lung cancer social media, all the way down the line. Brain tumor social media, yada, 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 yada. If anyone is interested in this, it's Simpler, SYMPLUR, and they have the Health Hashtag Project. When this came about, I think that they started maybe 10, 12 years ago, and out of the Health Hashtag Project came something known as tweet chats. Breast cancer social media, BCSM, has a tweet chat every Monday. There's other tweet chats available for other cancer groups. Now, I try to use hashtag lobular, hashtag BCSM for stuff that's for the breast cancer community. I use hashtags in a different way as well than Colleen mentioned. I will also use them for editorial comment. I will use them for a funny aside. I will use them for messages of hope and inspiration. I use hashtag just keep swimming a whole lot. And when I used to tweet with an account that was mostly anonymous, I used other hashtags very creatively as well, which I can't go into right now. but the point is, there's no hard, fast rules. If you want to be effective, you can, use the ones that are traditional. If you want to be a little bit more, go rogue a little bit or use it for humor, you can come up with your own. I started using a hashtag LobMob to describe all of us. And, I use that for a while, and I use it on Facebook. I use it on Twitter. I use it when I talk to people in person. But I think Lee Pate told me that there's some lobster restaurant someplace that uses that. So I've been using the hashtag LobMob a little bit less, but that's my hashtag primer for you.
Why, thank you. So we're just the next couple of seconds going to be talking about usernames. So for example, our username is @LobularBCA. It's also known as a handle. You can see it begins with that symbol. And then you do that to call out people, or what we call to mention people, to send messages to people, or to link out to a profile as well. And it's expected. It's a public format. Don't be afraid that you're going to mention someone. You may be really happy. You may get a reaction from them. So, and that's really what we want. But again, it could also take it to that larger audience. So our advocacy message could end up with a larger audience because they may see that and then they may retweet it as well. And then, talking about influencers a little bit, Diane, so besides yourself, besides LBCA, I know Lee's on the call, she's become a great influencer. Who are some other people and organizations that budding lobular breast cancer advocates should follow, in your opinion?
Well, I would follow any of the NCI cancer, comprehensive cancer centers in your locale, number one. If there's a cancer treatment center where you're being treated, if your doctor is on Twitter, follow all of them. You'll also want to probably follow the NCI, @the NCI, NIH, I think it's just @NIH, ASCO, obviously the American Society of Clinical Oncology, that's @ASCO, @NCCN News, that's the National Comprehensive Cancer Center. These are the big, huge professional organizations. With regard to personal accounts, there's @SubAtomicDoc, which is health care provider Dr. Matthew Katz, big influencer, @Dr. Don DeZon, he's a gynonc. who's quite an influencer, good messenger for all cancers, for advocate for all patients, at Dr. Attai, that's DrAttai, and at Stales. Dr. Attai and Alicia Stales, along with Jody Schauger, who's gone now, but Jody was the first lobular breast cancer patient I met and became friends with. The three of them founded the BCSM chat. So I think that those are good people to follow. Also, you may want to follow, other organizations, similar, nonprofits such as at Metaviver or any of those other American Cancer Society and that sort of things.
Great, thanks. And what we can do, folks, is we can write down that list for you, and Mason can share it out with you in a follow-up email as well, so that I'm sure I saw people are scribbling all over the place, so we can send that out to you as well. And then finally, types of posts with the most engagement. Diane, so especially if I'm a new tweeter, do you have any kind of recommendations about what you've seen, get the most likes, just get the most reaction in general?
I think that authenticity, it comes across. So I have put out, I put out some tweets that I notice get a lot more play than others. And they're different categories. Sometimes it'll be a personal tweet, like a personal triumph, like, hey, it's my 10-year cancerversary, woohoo, that sort of thing. Those often do well. Other times you raise other people up, and you raise other issues up and let people know how, like, this is really important. This is happening to this person. Can you help? Those can do really well. Information that's really key to the community, like posts that I made from live tweeting conferences often will do really well. It's just, crucial information, make it simple. I use humor a lot. I try to use a lot of wordplay because I'm a writer. That's what we do. So, those will often do well. So I'm trying to think of anything, like a specific for instance, and maybe I'll come up with one during the Q&A.
Great, thank you. So we are done with this part of the conversation that we're having. Now we want to have a little bit of a conversation with you. We have about 15 minutes for that. So we did go through the online presence. We talked about who the various audiences are for our social media platforms, why you should start using social media to advocate if you haven't already, some great advice on how you can get started, and information about our social media resources that are available. And then finally, we talked about Twitter and hashtags and who to follow and engagement. So now what we're going to do, first, don't leave yet, but I want to thank Diane for joining us today. Think about your questions, and we're going to take them in a few seconds.